Have you ever wondered if you can have a vaginal birth after a previous cesarean section? If you have questions like that, or you are wondering if you can try vaginal birth after a cesarean section, hold on, don't scroll past. This video is for you. Hello and welcome to Treasure Health Space. My name is Onyechi Linda. On this channel, we'll talk about everything women's health and fertility. If this looks like the kind of content you will like, before we continue, do well to subscribe, leave a comment, like this video and share it. Today we are going to be discussing safety checks for VBAC, vaginal birth after a cesarean section. What are the things you need to consider for you to know that it is safe for you to try? What are the things you need to discuss with your healthcare provider? Vaginal birth after cesarean section actually have up to 60 to 80% success rate, but there are a lot of things to put into perspective to be sure that it is safe for you to try. Okay, the first safety check you should put into consideration is your health history. What is your health history like? Do you have a good health history? Have you had a previous history of poor progress of labor? For instance, if you've had poor progress of labor because the cervix was not dilating, maybe you were in labor for 4 days, 5 days, and at the end of the day, you ended up having a cesarean section, know that it might not be safe for you to try a vaginal birth after cesarean section. What is the pregnancy interval? Is it up to 2 years? Is it up to 18 months? Okay, if you've had a previous cesarean section and within a space of 1 year you are ready to give birth again, you're already pregnant and you are due for delivery, vaginal birth after cesarean section might not be the best option for you. Next is the type of incision. Okay, the type of incision will also play a very big role to know if it is safe for you to try. We have the low transverse incision and the classical incision. So the classical incision carries a higher risk of uterine rupture and bleeding when you want to try a vaginal birth after cesarean section. So that is not to say that everyone with classical incision will end up with uterine rupture or bleeding. It just increases the risk. Another safety check you need to consider is the fetal position. Is the fetus in cephalic presentation? Is it transverse? Is it an oblique line? These are things that you need to consider before having a VBAC. Also put into consideration the facility you want to use. Be sure they have qualified hands on deck and they can provide 24-hour service, including emergency cesarean section and blood transfusion, just in case things doesn't go as planned. Also make sure that they have a CTG in that facility. Make sure there will be a pediatrician on ground. So having known the safety checks to consider for vaginal birth after cesarean section, just know that the success rate for vaginal birth after cesarean section would depend on if you've had previous vaginal delivery, if you go into spontaneous labor, if the fetus is in cephalic presentation, if you've had no previous uterine surgeries, no history of uterine rupture. Also, you don't have medical conditions like fibroids that can complicate delivery or problems with placenta location that can increase the chances of bleeding and other complications during delivery. And ultimately, your success rate increases even more if you go into spontaneous labor. On the other hand, your success rate for vaginal birth after delivery decreases if you have a large baby, if you have medical conditions like diabetes, asthma, preeclampsia, if you've had previous history of poor progress of labor, short inter-pregnancy interval, if you've passed your due date, and if you are obese. Well, to tell me your experience in this comment section. Have you done a cesarean section before?